we continue to see very high numbers of COVID-19 cases and hospitalizations. Across the state, cases to date now exceed 1.4 million Ohioans. Sadly, we continue to see more Ohioans ending up in the hospital, and in the Ohio Hospital Association data, they're reporting that 1 in 6 hospitalized patients in Ohio is positive for COVID-19, and 1 in 4 in the ICU are battling COVID-19. Thankfully, we are seeing early indicators that cases appear to be peaking and beginning to point toward a decline. I'd expect that hospitalizations and deaths should soon follow. Now, I know it has been a very long journey. We're all tired of dealing with COVID-19, but I'd ask everyone to hang in there. Although our cases of COVID-19 remain extremely high, it is clear that our collective efforts really are paying off. We need to remain vigilant, and we need to protect ourselves from the spread of COVID-19 through vaccination, and especially in our schools where so many of our students either cannot or have not yet been vaccinated, wearing a mask. These are the keys to not only remaining healthy, but also to alleviating the currently intense pressure that is on our healthcare systems and our children and adult hospitals, really across the entire state. Today, I'd like to share some information about a few new dashboard changes that you may notice moving forward at our coronavirus.ohio.gov site. First, consistent with CDC reporting, we will be listing additional doses on our COVID-19 vaccination dashboard. Starting this afternoon, there will be a new drop-down menu that will show how many Ohioans have received additional doses. Secondly, we often receive questions about vaccination among specific age groups that are not currently listed on our dashboard, particularly for school-aged Ohioans ages 12 to 17. This information also will now be available as a new dashboard under the Vaccine tab. And it will share information for supplemental key age groupings, both at the county and the state level, including age brackets of 12 to 17, 18 to 19, 30 to 59, 60 to 79, and 80 and up. Finally, as a part of regular public health practice, the Council for State and Territorial Epidemiologists and the CDC collaborate every year to create an update for case definitions for public health surveillance. Case definitions are important because they provide a national standard framework for how to count and classify any disease, including COVID-19. As a part of the most recent review process, the case definition for COVID-19 was updated to reflect our latest understanding of the virus and how it works, and it has broadened that definition to include those who might be reinfected with COVID-19 90 days or more after a previous infection. So, in alignment with national guidance, the Ohio Department of Health will be counting any individuals reinfected with COVID-19 from September 1st on as a new case. And that will be reflected on our dashboards based on the specific, confirmed, and probable case definitions. So that part won't change. Although the state and local health departments have been implementing proper public health action for reinfected individuals all along, such as isolation of infected individuals and quarantine of their close contacts, these new infections haven't been counted on the dashboard because they didn't meet the case definition standard. This updated definition provides better insight into the real spread of COVID-19 across our communities. The new definition does not apply retroactively to any individuals who might have been reinfected prior to September 1st. For example, someone who may have been infected in April of 2020 and again in January of 2021 will continue to only be counted one time, as this was the case definition at the time. If that person's infected today, their new case will be counted in addition to their original case. So for clarity, only new reinfections after September 1st will be reflected on the dashboard, and they won't be separated from other cases. Much like anyone else infected, they'll simply count as a case. It's important to note that emerging information shows that those who were not vaccinated are in fact more than twice as likely to be reinfected compared with those who are fully vaccinated. All the more reason to choose to be vaccinated.